There's a lot of symptoms that can be associated with IBS. Some people might complain of some gas or bloating. Other people might have complaints of constipation or diarrhea.
Abdominal cramping, nausea, heartburn.
That range of symptoms varies among people. Somebody with diarrhea may only have one episode of diarrhea a day. Some people might be besieged with it and can't leave the house.
As a rule of thumb, if you're experiencing any GI symptoms from mild to severe, it's always a good idea to reach out to a healthcare professional. There may be things that we can do to help you, ranging from just changing your diet, lifestyle modifications. There are medications that we can use that have little to no side effects that can also really help those symptoms that people are experiencing on an everyday basis.
Fiber is the mainstay, probiotics. Sometimes it's as easy as doing journaling to find what might be your trigger food or situations. So some people are put under a lot of stress or they're uncomfortable, and that might precipitate their symptoms.
IBS is irritable bowel syndrome. Inflammatory bowel disease would be IBD. That includes Crohn's and ulcerative colitis. In those conditions, those are more systemic conditions and autoimmune diseases where we actually have findings and evidence of inflammation in the colon through procedures, through stool tests, and sometimes even on blood work. Irritable bowel is more of a diagnosis of exclusion where we've ruled out other things, testing has been negative, and people are still left with these pretty bothersome symptoms.
The goal of treatment for IBS patients is really to manage their symptoms. People don't realize how consumed their symptoms can be in their life. They make exceptions or they adapt to that and they don't realize things can actually be better. It's kind of like a new lease on life, and that's basically how they would describe it. My symptoms are better controlled, I feel good, it's so much more manageable, I can live with it, I have a better quality of life, and that's what we're out here for, is to make people's lives better and happier.
Sometimes it takes a little while to get there. It's a lot of gut-brain axis in IBS, so it's not just targeting the gut, but also targeting psychiatric and mental health, which plays a big role in it. A lot of therapy and getting through certain things.
The most important thing is to take away the embarrassment or the stigma that people associate with GI complaints or bowel issues. Your symptoms are very common. It's not unusual for you to not want to talk about things that you consider to be private. It's okay to talk about these things. We want to hear about these problems. You're not alone.